This episode is brought to you by the Practice Launch Club. You can find out more about that by going to practiceoftherapy.com/launch club, and also by TherapyNotes. And you can find out more about them by going to practiceoftherapy.com/therapynotes. Hello, I'm Gordon Brewer, and welcome to the Practice of Therapy podcast, where we explore the business and clinical sides of running a private practice. This is episode number 235 of the Practice of Therapy podcast. I'm Gordon Brewer. Glad you've joined me, and glad you've joined us, rather, and that this is the last of the podcast takeover by my good friend Whitney Owens at whitneyowens.com. Whitney has been a dear friend of mine over the last several years, and we are in a mastermind together. And when we came up with this idea of podcast takeover, Whitney jumped on it with me, and I'm so glad she did, because she's had some great stuff. If you haven't done so, go back and listen to the last 3 episodes before this one, where you get to hear from Whitney talking about just her private practice journey, and also her talking about the ebb and flow of private practice. And then also in this last episode, just talking about how to be more effective really with your intake calls, and what you do as far as we like to say, converting inquirers into clients. And so in this last podcast takeover episode, she talks, kind of continues with that topic a little bit with 2 of my other good friends, Potratz and Nathan Hawkins, and they joined the podcast takeover, where Whitney interviews them and talk about their business called Shrink Think, and just some of the work that they're doing around using videos as part of training clients in the intake process. So I'm looking forward to you hearing Whitney's conversation with them and all of that. And also, before we get to Whitney's conversation with Aaron and Nathan, I'd love for you to go over and check out the Practice Launch Club right now, especially since we're closing out the month of June. The founding member opportunity is going to be ending. And so don't want you to miss out on the discount that will give you of the Practice Launch Club. And so be sure to go over to practiceoftherapy.com/launch club to find out more about that. And you're going to hear a little more about that here in the intro of the promos that we do for our sponsors. So stay tuned for that. And also, I'd love for you to find out more about our sponsor of the podcast, TherapyNotes. And there you can find them at practiceoftherapy.com/therapynotes. And so real quickly here, before we get to Whitney's conversation with Aaron and Nathan, I'd love for you to hear more about the Launch Club and TherapyNotes.
As your practice grows, the systems and processes you have in place will keep your practice running smoothly. That is why it is important to have an electronic health record system that is specific to mental health providers. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. They are who Gordon uses in his practice. And did I mention that they are one of the top-rated EHRs for mental health private practices? Their support is also second to none. Be sure to check them out at practiceoftherapy.com/therapynotes. Be sure to use the promo code GORDON to get 2 months free. Starting and growing a private practice has a lot of moving parts. In those beginning stages, there's a lot to learn about running a practice and the business side of things. The problem is, there is no real structured way to pull it all together. but you don't have to go it alone. Introducing the Practice Launch Club, an exclusive private membership community from the practice of therapy for clinicians in the beginning phases of starting a private practice. The Practice Launch Club will give you the support and structure you need to get started with your ideal private practice. It will guide you through the A to Z of starting and growing a private practice. You will have monthly Zoom meetings with the other members in Gordon, monthly training sessions and workshops with other private practice experts around topics specific to private practice. You will also have access to a resource library of private practice resources along with quarterly individual consulting. There will also be retreats and workshops exclusively for the members of the Launch Club. Did I mention it is also affordable? For less than what you would charge for one client session, you can be a member of the Launch Club. So you get a good return on your investment. There is no risk. You can cancel anytime. Check it out at practiceoftherapy.com/launch club. Enrollment is closing soon, so join now.
Hello and welcome back to the Practice of Therapy podcast. This is Whitney Owens. Yes, I am finishing up the podcast takeover. This is not Gordon's voice with you today. So when Gordon told me to take over this podcast, I was like, yes, please, because his podcast is awesome. And then he said, you should invite cool people to interview on the show. Well, the first people I thought of were my friends, Potratz and Nathan Hawkins. So, hey, guys.
Hello.
Hey, guys.
Hey, y'all.
Hey, y'all. What's happening?
Yeah. So how's your day going?
Great. It's been super busy. We've got a couple of expansions going on. So we're just like running around with all the details, getting keys and office furniture and living the dream.
That's lot of furniture. A lot.
That's good. That means you're going to have a lot of clients.
That's right.
Yeah, all you have to do is buy the furniture and they're going to show up.
Right.
Yeah, if you build it, they will come. That's right. So tell me, for the people that are listening, if they haven't heard of you before, just give us a little snippet about who each of you are, a little bit about your practice and what you do.
So I'm Nathan Hawkins, do life encounter counseling, and then also Aaron and I do life discovery counseling, which is another practice together. And that has 2 locations. And that's one of those locations is moving from one city to another. And then we have a new business too called Shrink Think, and also do a Shrink Think podcast. Your turn, Aaron.
Yeah, that's exciting. And so I always tell people it's like a little bit of a yours, mine, and ours situation. You heard the yours of Nathan's business, and then I've got the mine, which is Discover Counseling. And then the ours is the life discovery counseling. And now we have like babies. We've got Shrink Think and we've got Shrink Think podcast. So maybe we'll have some grandbabies eventually with like some other businesses. Who knows? It's funny. I was talking with one of the ladies in my mastermind, and she was like feeling a little down. And she's like, "I'm feeling down. I think I want to start another business." That's what we do.
That was awesome. That is kind of sometimes what it's like. I was just recording for Gordon's show right before y'all came on and was talking a little bit about that, how when my practice was like running smooth and I might have been getting a little bored, I was like, what's next? Right?
Exactly.
Yeah.
Buy a franchise. Just kidding.
That's right. So when I talk to y'all, I feel like next time we do a podcast, we need to do a whiteboard. And you can like draw out your practice, our practice, these things, our grandbabies they'll happen.
Right.
We can have it all on like a family tree whiteboard thing, and it will be awesome. Yeah. So today we're specifically going to focus on Shrink Think because y'all are launching some really cool stuff. And so Aaron and Nathan actually were at the Faith and Practice podcast. What am I saying? Faith and Practice conference back in April, where we talked about Shrink Think, and they did a presentation. And I was so enthralled and excited that I was like, you guys have to talk about this on Gordon's podcast because I want everyone to hear about what y'all are doing. So why don't you give them kind of a snippet and then we can kind of get into the details of it.
Yeah, I think that the snippet really is that we're doing videos really that are just really short that introduce therapy to people and get people ready to come into your practice as a therapist, and like really ready. It saves, I think, everybody time. I'm going to let Aaron talk more about it.
Yeah, there's just as we were doing the podcast, we realized that this is actually of tremendous value. There's something here that people don't realize. Actually, for us, we didn't realize what we had. We're like, actually, this is really valuable. We're talking about things that most people are like, wow, can you actually break that down even more? Can you tell us more about that? People that have been in therapy for a long time still tell us like, man, I've been going to therapy for like 5 years. I still don't know what I'm doing. Or people that are just starting are like, I have no idea what to do. I don't know how this works. And so Shrink Think is, like Nathan said, these educational videos that are online, they're all digital, that people can watch on their own outside of session, before they even get started with therapy, to learn about what therapy is, how to set their goals, maybe a bit about like insurance and payments and that kind of stuff. What to talk about each week, how to know when they're done with therapy. Basically, like Nathan said, just completely get ready for therapy so they know how to do it well. And the benefit of that is that for therapists who normally have to do this in session over the course of a couple of weeks or whatever, they can just send a link to Shrink Think and give clients access. They'll enroll in the course and they'll watch these videos before session so the therapists don't have to talk about this stuff. It's being done for them. And then for the clients, it's awesome because they're not paying money to hear a therapist. It's part of the process, we get it, but they're not paying money to hear somebody kind of talk through them this administrative stuff that is important for the process, but it's not therapy.
Mm-hmm.
Well, not only that, I mean, like, there's a lot of stuff I think that gets skipped because a lot of times I think just asking or answering maybe direct questions that the client has. And then you remember like, oh, I should probably talk about this too. And the thing that we did is just very complete. And when the person came in, they will have some expectations for how things are supposed to go. And I think that's cool because as a therapist, the better, more savvy the consumer is, I mean, the better I am, because I'm like, we're like a team that's trying to fix this problem.
Mm-hmm. Yeah, I've heard y'all talk about it before, and you just made me think about a few different things as you were sharing. Even one of my employees, I met with her not too long ago because she wasn't having great retention and she just started, and it's her first time doing private practice. But then I kind of was talking to her about, oh, well, you should say these things to your client. You should say these things. And now as you're talking, I'm like, I wouldn't have even had to have had that meeting. If she was had watched the videos, even though this video that you're talking about right now is for clients, but you're speaking as therapists, that I could have my therapist watch those same videos so that they know what y'all are telling the clients. And then they can really expedite treatment and say the right things at the end and things like that. But, it's even when I go through training with them, I can't remember everything that I need to tell them, or I told them and they forgot because they're just flooded with so much information.
Yeah, that's the cool thing that I think as we were developing this, we were realizing it's great for practice owners as well, like yourself, people that have several different clinicians who you have to manage and supervise. And you don't really know what each person is saying to each client. And you hope there's some consistency. Maybe we got to make sure we talk through these things every time, but you forget or you get into a groove or whatever. Well, this way you can have consistency for your practice. You can make sure that all of your clinicians are communicating these things to their clients, that all of your clients are hearing the same thing. And then the cool thing that I also really like, which I do a little bit of this in my training of my employees as well, is I'll record some of those things on video or audio so that people can replay them. So that's the cool thing for clinicians or even clients. They can rewatch the videos and go back and get that information. If they're like, oh yeah, I remember like weeks ago, learning this or whatever, what was that again? And then they can go rewatch it whenever they want.
Yeah. And one thing I've heard y'all talk about before is kind of the value of it being someone else other than the actual therapist, right? Because you might be telling a parent that's watching a video for their kid or a client themselves, they might hear something that's a little harsh or a little hard to like think about. And so you're able to say it, instead of the therapist having to address it, or maybe therapists aren't as confrontive. And so it's good that y'all are able to do that for them.
Yeah. And the other piece too is like, I think it weeds stuff out early. I mean, our field is really busy. And I think if people were to listen and then find out like, oh, I don't even know if this therapist I'm seeing takes Medicaid, maybe I didn't ask them that. Right. So then they call back up and go, hey, I guess I can't meet with you because whatever, which it just is what it is because it would have happened anyway. And then you end up not losing that hour because they figure out ahead of time. The other thing too is that a lot of younger therapists don't really understand in working with children how it works with custody evaluation versus like writing letters and stuff like that. And so this comes up in front and says, this is what your therapist is not going to do. And they don't really have to deal with that in the room because we already do.
That's good. Yeah. And even as mandatory reporters, I feel like we tell our clients that and they just don't get it or they forget what that is. And then they start telling you things and you're like, whoa, I'm a mandatory reporter. I want to remind you, so it's, that's another thing that like, I'm sure y'all go through in the videos to help people understand.
Yeah, exactly. It's really interesting. It's kind of like a lot of times when you speak to these things for people, and I say this in my intake with people, I'll tell them a lot of information. I'll communicate a lot of these things. And I will answer a lot of the questions you had and probably answer a lot of the questions you didn't even know that you had. So when they watch these videos, I'm guessing a lot of people they'll realize they have a lot of assumptions that they didn't even realize were there that we'll speak to. And they're like, oh, I guess I was imagining it would be this other way. And now it's not. And so I need to orient this way instead from therapists. You're hearing that from therapists who actually do this. So we're hoping that it just gets everybody kind of on the same page. And that's kind of our slogan is bridging the gap between clients and therapists.
I love that. Yeah. So let's go through some logistics. You know me, I like logistics and practicality and how's it actually going to work. So let's say that somebody's listening and they're thinking, okay, this sounds really cool. Like, how do they actually get in it and how do they send the videos and like what step by step is the client going to go through? If you can kind of walk through that process.
Yeah,
that's
absolutely. Yes. It's me because it's been a bit of a technical beast to figure out with all the platforms, but we figured it out. So here's what you do. If you're a therapist, you'll go to shrinkthink.com and you will click on the link to subscribe to our membership package. So it's a monthly membership fee. And that gives you access to all of our videos, and it gives you the ability to send the link to all of your clients. So you as a therapist are going to pay a monthly subscription fee, $24.95 right now, for these orientation videos. And then you'll get an email that tells you what to do. And it's going to tell you what to communicate to your client, like how to say it to them, like over the phone or in an email, because you need to communicate that right off the bat. And then also where to put that in your intake paperwork, just a little statement that's got, a reference to these videos and how they're helpful. And then there's going to be a link with a code in it. And that's what you're going to send to your clients. So if you just copy and paste that into your intake document, then it's automatically going to get sent out to all of your clients. And hopefully that's going to be an automated process from now on, so that when clients come in for the first session, or some people, they will check in before the first session and make sure they filled out the paperwork. They'll say, and also, did you happen to watch those Shrink Think videos to get oriented? And so you can follow up and make sure that people have done that. Now, on the client side, what they will do is they will get that email that will take them over to our course platform, and they will enroll in the course, just like you're going to, enroll in some other mastermind course or an educational course somewhere out there. And they will watch through these videos. They'll see their progress. We've got the text of it, the transcript on the page, so people can reference it again, and they'll complete the course and be ready for therapy.
Oh, great. And I know you're probably not going to remember all the courses. I think I remember you saying it's about an hour long, like the whole process for a new for a new client. Can you kind of walk through what you're talking about in the videos again, kind of step by step?
Yeah,
Yes.
I am actually looking up shrinkthink.com right now.
That's awesome.
I'm like, let's just see what's, because when Aaron and I recorded them, we basically did two different, like I did 3 and he did 3, which those 3 were broken down even more. So the videos are only like about, I want to say maybe 2 minutes each. So people can feel kind of accomplished as they go.
That's nice.
And when we talk about things like the differences between a psychiatrist, psychologist, and a psychotherapist, licensed clinical social workers.
I've got them right here. The topics right here are orienting. So like in 6 different modules. And I actually have only 4 or 5 written down, but orienting to therapy. So like the theoretical approach or the personality and fit. It's kind of a bit of like how you pick your therapist and how to know if this person is going to be right for you, which is funny because sometimes people have done that research before they come to us as therapists. And sometimes clients really, they have not. They're just reaching out to a bunch of people. Mm-hmm. And so maybe this will help. The way I kind of thought about it was it'll give people an idea of if this is the right person, you'll feel good about it. You're like, oh, good. After watching these videos, you'll realize, yeah, this therapist is the person I want to work with. Or you'll realize, oh, actually, I'm needing somebody who's a specialist in this other area that I need. Maybe this might not be a good fit. And maybe I can bring that up in the first session to actually address. So orienting, and then there's a getting started in therapy. So it's kind of like what happens in the first session, like what do you share and not share? How often do you meet with somebody? How to talk about treatment planning or evaluating your experience after the first session. So it's kind of like, okay, I did therapy. I had this one session, right? Okay, what does that even mean? Like, was it good, not good? And how do I even know if that was helpful or beneficial or on track with what I wanted? And then you have like this working well with your therapist when you get stuck in other difficult issues, topics that are really about working with your therapist, some of the nuances of that. And we talk about some of those things on our podcast, the Shrink Think podcast, like honesty. Your therapist is not your friend. I actually had a client that referred somebody, and she reached out to me and said, hey, I think I need to schedule with one of your therapists because I listened to your podcast called Your Therapist is Not Your Friend. And she was like, yeah, my therapist is acting like my friend, and that's why we're not going anywhere. I need a new therapist. And no offense to that therapist, but she just had realized she's gotten everything that she needed out of that person. And she was ready to move in a different direction. And now she knew exactly what that thing was. And so then lastly, how to recognize your progress and know when you're done. And then I think, Nathan, there was another one that's about like finances, like insurance and that kind of thing. Is that the one you talked on? Yeah.
Yeah. Cash pay and finances and insurance. So the benefit of cash pay, stuff like, hey, trying to encourage people to really consider that because you don't have a diagnosis, it's going to be easier. It's easier on everybody all the way around. But then also explaining like EAPs, like what those are and how, I think I even might have done it now, like the idea of how clinicians decide to get involved in different insurance places, like why they do what they do. Like they might not be on your panel. I don't really necessarily go outside and say, because that company sucks and they don't pay. Right. But that's what's happening anyway. But yeah, so, and the difference between Medicare and Medicaid, and that kind of thing.
Yeah. Well, this is super helpful. And I think that all practice owners would really benefit from this and really their clients. Like you're going to expedite treatment, have better treatment outcomes, very likely because clients are going to know things and you're going to save so much time. Most definitely. And then I think we talked about, you've got some other ideas as far as like videos, maybe for training for group practices. Tell us a little bit about what you're thinking in the future.
Yes. We have a little bit of a roadmap that we've mapped out. We've got some of the content already mapped out, but you were talking, Whitney, earlier about like if your therapist is going to see a child and they need to work with the parents or whatever, and how we can speak to some of that. I mean, that's one of probably the most difficult things therapists have to do is to communicate with parents about their children or work with parents who may be difficult to work with. And so we want to be able to address that. Like, okay, if your child is going to go to therapy, here are all the things that you need to know to get oriented. Couples therapy was another thing we were talking about, orienting, because it's different from an individual, right? There are things that people need to know that therapists will do and not do. And it's just a different vibe. It's a different way of going about things. And you want to pick a different therapist for that than you would for an individual therapist. Like, it's funny that people might not know that there are therapists out there that are like, nope, I don't see couples. I do not like working with couples. I just stick with individuals. And some couples are very highly trained. So
yeah, like, so maybe even doing some future stuff like inpatient versus outpatient, just getting people to understand how those transitions work. I don't know that we necessarily go into specific ever like diagnoses or anything like that, but that's not, I don't think, totally off the table for some of the stuff that seems a little bit more kind of overblown, where people are like, why is everybody calling me bipolar? Because I feel like that one's like way overstated all the time, and it actually has.
And maybe we'd have to do one that's like your girlfriend's emotions do not mean that she's bipolar, for example.
Right,
your husband is not a narcissist, right? He just doesn't know how to communicate about his feelings. It's like those kinds of things that everybody talks about.
Yeah. And I think when we were at the conference, we also talked a little bit about training videos for therapists at group practices. That's something that I'm actually very interested in.
Yeah, we're really excited about that. So imagine, because, oh my gosh, as a practice owner, when you hire somebody, like how much time it takes to just orient them to your practice, let them know what's going on. What are the ways that you do it? But even inside what are the ways that you do it, there's a bunch that is just across the board that needs to happen that Aaron and I, for example, can explain, that's very general and really annoying to repeat, like, quite frankly. Because the other piece of the pie is that you want to set this new clinician up for success. And honestly, a lot of times, I mean, you kind of feel like you're the only one that can do it. You can't really pass that off. Mm-hmm. Like to a situation that's like where you're like, oh, I've got this other person who's a clinical director, maybe I'll have them do it. It's like, well, you probably got where you are because you understand how to move clinicians into a place. And maybe it's not like this thing where you can just rubber stamp it. So it's, and then clinicians moving from community mental health to private practice. What's the difference with that? I mean, helping them to understand how to talk about cash pay, or not even just cash pay, but how to actually take money. They're very uncomfortable when they, a lot of times coming in, and now they have to ask for money. If your site is set up in such a way that maybe the reception or whatever doesn't take it, but no matter what, that therapist is probably going to get questions about finances, and so how to navigate that. I don't know if you have anything to add, Aaron.
Yeah, it's that whole idea of consistency throughout your practice, and then repeating things outside of like a supervision meeting or an orientation or training meeting that can happen, before, like on somebody's own time. I just was this week I just hired a new guy, and he's great, very intelligent, he was in academia before, and has worked in a private practice before, but not super experienced with the private practice world. And so there were a bunch of things that I needed to teach him. And we've been discovering this week that there were some miscues, some misunderstandings about some of this stuff. And so I've had to repeat some of it to him. I've had to kind of go into some more of the details and repeat some of that. Well, if we had videos up, then I would send him over to those videos, and he can watch those and know exactly what to say to his clients. And then he can go back and rewatch those, because maybe he kind of understood it the first time. And then maybe he started working with a few clients and was like, oh, I think I know a little bit better what that means, but I want to go rewatch. I think there was something in it that was really, oh, yes, I was missing that piece. So It can actually be a little bit of a guide for therapists. And it's not just orienting, like I worked at this Circuit City place, like a Best Buy way back in the day before anybody got hired. You sit in front of a computer and like watch all day and like take a stupid test, and then you can work there. It's not like that. It's like so much more interactive and updated information that we can give people, that they'll know stuff and then also know what to do and what to say for their clients.
Yeah, I can't imagine the two of y'all being boring, actually.
We get bored with ourselves, and then we are like, okay, it's time to spice it up here.
Or time to start a new business.
Yes, that's right.
Yeah. Well, I think this is awesome. I'm really excited about this getting up and going and getting involved in it, trying it out. And I know you also have an email list. Is that right?
We do. It's up on shrinkthink.com.
Okay, great. So make sure, listen to this episode, that you join the email list so that you can find out when new products, services, different videos are coming out. You can get those emails and know exactly when it happens.
Well, big thanks to Whitney, Aaron, and Nathan for being on this podcast takeover. And I'm so glad that Whitney invited Aaron and Nathan. They are two good ones. And I'd love for you to go over and check out their things at the shrinkthinkpodcast.com, just shrinkthinkpodcast.com. And there'll be links here in the show notes and the show summary to find out more about that. And again, I can't say enough about the fact that Whitney was willing to do this podcast takeover for the month of June. And I think we'll probably end up having to do this more often because I think it just gives some more unique voices to this whole space around private practice. And one of the things I will say about most all of the consultants that we work with are at least that I work with, or just in this private practice space, are so collaborative and so giving, and we just help each other out so much. I'm appreciative to Whitney and just the work that she's done doing around faith-based practices and that whole niche, and then just several others like Nathan and Aaron, and then others, Uriah Guilford, Jessica Tapana, and Ernesto Sesmangundo, and just David Hall, and just tons of others that are out there that are good friends that I'm glad they're doing the work that they're doing, and that helping folks like you that are listening to those podcasts be successful in their practices, and just the diversity of help that you've got now. It hasn't always been that way. So anyway, didn't mean to get too far off on a tangent. I'd love for you though, before the end of June comes, to go and check out the Practice Launch Club. And particularly if you're in those beginning stages of running a private practice or starting a private practice, the Practice Launch Club is there to provide you the resources and support that you need to get that started. So be sure and check it out at practiceoftherapy.com/launch club. And also, I'd love for you to find out more about TherapyNotes. They are the leading electronic health record system for private practices, and they are who I use in my practice, so couldn't do without them. So be sure and check them out at practiceoftherapy.com/therapynotes, and use the promo code Gordon, just GORDON, and you can try them out for 2 months for free. And also, before we close out this particular episode, I'd love for you to take time to go into your podcatcher, wherever you're listening to this, and click on that follow button and follow us wherever you're listening to the podcast. It just helps us get our ratings up and helps other people find it. And also just lets me know that you're enjoying the podcast. And also you can leave us a review and also a rating of the podcast. That also helps as well. So take care, folks. Again, thank you, Whitney Owens, for the podcast takeover in June. And for those of you listening that haven't maybe heard the other 3 episodes besides this one, go back and check them out because they're good episodes. So take care, folks, and we'll be with you from here on out. Take care. You have been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free Private Practice Startup Guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.